research study will be comparing an advanced clinical massage protocol versus the same protocol plus strengthening exercises in the treatment of knee pain in runners. If you run at least once a week and are experiencing pain in the knee, the following presentation might be of your interest. Listen carefully. The massage protocol used in this study was designed by Fairweather and Mary and immortalized in their popular book, Massage Fusion. We'll be using advanced techniques that have been most successful in clinic: trigger point therapy, myofascial release, soft tissue release, acupressure, advanced stretching, for passive stretching, PNF, and AIS stretching, between others. For strengthening, we'll focus on hip abduction. Reason being will be displayed later on in this short video. But let's have a look now at the science behind this study that will hopefully clarify why we chose these protocols. Shall it all begin with the fascia? Defined at the latest Fascia Research Congress as a connective soft tissue system in our body that forms a whole body continuous, three-dimensional matrix of structural support. Now what the heck does that mean? Well, we're basically talking about a three-dimensional piece of fabric that runs throughout our entire body and it goes down to the cellular level. As you can see in that table, fascia can be found in nearly every tissue of our body, which is crazy considering that it's a single piece of fabric. We see here a breakdown of fascia within a muscle. The epimysium, or outer layer of fascia, surrounds the muscle, and as we go within, we find two more layers of fascia surrounding each fascicle and each muscle fiber. Water takes a big part in the composition of fascia, which gives it that particular look under the microscope. But how does fascia affect our running? Well, as it is a single piece of fabric, strains in one area can be transmitted elsewhere, causing a structural imbalance or pain, affecting our biomechanics and the way our body moves. The fascia links up the muscles in chain like a set of sausage links. Pull one end, a restriction could do that, and you'll be pulling the whole thing. Tom Myers has studied and followed the chains of muscles and fascia to see what links with what, giving us a bit more of insight within this fascinating world of fascia restrictions. Let's now move to the next big element that would affect our running: trigger points. Generally known as knots, trigger points are in fact painful nodules found within a taut band of the skeletal muscle. In trigger point formation, a group of sarcomeres are stuck in contraction and unable to let go. This results in an area of shortened muscle and its interrelated fascia. But how are fascia and trigger points related? And what comes first? Like the story of the chicken and the egg, fascia dysfunction can lead to the formation of trigger points just the same way trigger points can lead to fascia dysfunction. In-clinic evidence shows a more positive outcome when both elements are addressed. Let's take a close look now at the knee, our biggest joint. The nature of this joint is to move only in one plane, the sagittal plane, with flexion and extension of the knee. An imbalance resulting on the knee joint moving side to side is a risk of injury and pain. The patella is a small bone that sits at the front of the knee joint and drags up and down as we flex and extend the knee. Both trigger points and myofascial dysfunction could affect both the tracking of the patella and the plane movement of the knee, creating pain and dysfunction. Research shows weaker hip abduction and late activation of glute medius in runners presenting with patellofemoral pain syndrome, or pain in the front of the knee, in relation to those running pain-free. The above points, along with the researchers' own experience treating runners in a clinical setting, are the fundamental basis of this research. The therapist will be looking at addressing both trigger points and fascia around the hip and thigh muscles through a series of 6 weekly treatments. A strengthening program will be added to one of the groups. With that aim, we are recruiting participants to take part in the research. The inclusion criteria being must be over 18, must run at least once a week, must experience pain in the front of the knee. Please note, no improvement in pain can be guaranteed, although all the above suggest that an improvement, if not a complete relief, the symptoms might occur.